Hey, welcome to The Explainer. Today, we're going to tackle one of the most common and honestly one of the most dangerous beliefs we have about our health. It's a misunderstanding that quietly leads to some really major problems. We're talking about our teeth and the silent story they tell long before any pain ever shows up.
So let's just start with a question that feels like total common sense, right? Most of us, we use this as our own personal dental checkup. Does anything hurt? And if the answer is no, we figure, hey, we're all good. I mean, pain is the body's alarm system, isn't it? If that alarm's not ringing, there's no fire. But what if I told you that when it comes to your mouth, that logic is completely 100% backward? And this is it. This is probably the single most important thing to take away from our whole conversation today. By the time a tooth actually hurts, a problem has probably been brewing for months, maybe even years. Pain isn't the early warning. It's the final desperate cry for help. Okay, so let's really get into this. We're calling it the no pain myth. And this one belief, the idea that if it doesn't hurt, it can't be serious, is pretty much the foundation for some of the biggest, nastiest dental emergencies people run into.
No, that is not an exaggeration. The research is really clear on this. This one misunderstanding is responsible for more tooth loss than pretty much anything else. Just think about it for a second. All the big stuff, root canals, teeth that crack in half, extractions, they almost always start in complete and total silence. That person who suddenly breaks a tooth at lunch, they probably felt perfectly fine that very morning.
So why, right? Why doesn't our body give us a heads up? Well, it all comes down to the basic biology, just the way our teeth and gums are built. There are two really huge reasons for this silence. First up, your tooth's enamel, that's the hard, white, protective shell, it has absolutely zero nerves in it. None. So a cavity can literally drill its way through that entire layer and you won't feel a single thing. And then second, early gum disease, it gets its start deep in the little pockets between your teeth and gums, and that's an area that just doesn't have a lot of pain receptors. So, no pain.
So, knowing that, let's meet the main characters in this silent drama. We're going to break down a list of the 5 most common dental problems that sneak up on you without giving you any warning at all.
And just to set the tone for how serious we're talking here, here's a quote from Dr. Maryam Saifi. She calls gum disease the silent killer of teeth. I mean, that's a really powerful statement, and it just highlights how destructive these quiet, hidden problems can actually become.
All right, first on the list, early cavities. They don't start out as some big, obvious dark spot. No, they love to start in hidden places, like between your teeth or under an old filling, maybe even below the gum line. By the time you feel that little twinge of sensitivity when you have something cold or sweet, the bacteria have already broken through the enamel and are well on their way into the next layer of your tooth. Culprit number 2, cracks and stress fractures. These are a huge reason for dental emergencies, and they are so deceptive. They usually start as these microscopic little fissures, maybe from grinding your teeth at night or just stress on an old filling. You feel nothing as that crack slowly, silently travels deeper. Until one day, maybe you're eating something as soft as a piece of bread, and bam! It hits the nerve or the tooth just splits. Next up, we've got 2 really big health issues. Culprit number 3 is early gum disease. In this stage, the body's silent response to bacteria is to just let the bone that supports your teeth slowly recede. This creates deeper pockets around the teeth, and none of that is painful in the beginning. Then there's culprit number 4, the earliest signs of oral cancer. These often show up as small, flat, totally painless spots that are incredibly easy to just dismiss or not even notice.
And our final culprit is kind of like a Trojan horse, a failing filling. The seal around an old filling can start to break down, and that lets decay sneak in right underneath it. You don't feel a thing, but inside, a cavity is growing that can lead to a huge fracture or the need for a root canal. And this is something that only a routine X-ray can actually spot.
Okay, I know that all sounds pretty concerning. But look, if we can't feel these problems and we can't see them, how in the world are they ever found? Well, this is exactly why those routine dental visits are so incredibly critical. It's all about using the right tools to find problems before they ever make a sound.
So, the crucial point here is that a dental visit isn't just about cleaning your teeth. It's really a diagnostic mission into the unseen. Your hygienist and dentist, they're trained to be detectives. They're spotting plaque below the gum line. They're measuring those little gum pockets. They're identifying tiny cracks, and they're using x-rays to find decay hiding between your teeth. They are hunting for the exact silent culprits we've just been talking about.
And this brings us to the payoff. Why does all of this early detection matter so much? Well, it really boils down to a simple choice you get to make. The choice between a minor preventative fix and a major, expensive, and often painful procedure.
Look what happens when a problem is caught in that silent stage. An early cavity, that just needs a simple filling. A little bit of gum inflammation, that can usually be reversed with a routine cleaning. A tiny microcrack, that can just be monitored or maybe sealed. These are simple, preventative, and way less expensive fixes.
Now, let's flip the coin. This is what happens when we wait for the pain. That same cavity, now it's deep and it needs a root canal and a crown. That gum inflammation has turned into advanced disease which leads to bone loss, maybe even tooth loss. And that little microcrack is now a fractured tooth that needs a full crown or might even have to be pulled. I mean, the difference is just night and day.
And this really gets to the absolute heart of the matter. Proactive dental care isn't about being afraid of the dentist. It's about using the dentist to stay in control, to avoid the crisis, to avoid the pain, and to avoid that emergency visit that, let's be honest, nobody ever wants.
So we'll leave you with this one final thought. Now that you know that pain is the absolute last sign of trouble, it's worth asking yourself, what silent story might my teeth be telling me right now? And maybe, is it time to go have a listen?